What is your stance on national health care?
I think I voted in favor of the Affordable Health Care Act because as we invest $2.4 trillion today, $1 trillion today in the health care programs for Americans, has got to be the belief that there's room for improvement. We go with 30 to 40 million people uninsured, and that is costly to the system. And so there was a need to make certain that we hold down the costs. Status quo simply would not cut it. We were informed by those who are expert in the arena. They factored in a number of $1,800 per year per family plan as the growth factor if we did nothing. So the basic cost today of a family plan is about $13,000. Had we done nothing with the Affordable Care Act, we would have seen in a short decade that $13,000 grow to $31,000. That's $1,800 per year. Over a course of 10 years would add $18,000 to the $13,000. So a $31,000 average health care plan is simply not sustainable. And something had to be done. And I think there are a lot of reforms to the system that will strengthen our people, strengthen our system, and strengthen our economy.
Okay. Do you think it should be universal, and why or why not?
I think it's important for universal because, again, there is, when we don't cover all, there is this a huge factor called uncompensated care that is assessed us in our insurance premiums and in our taxes. And people would love to believe that we don't cover the 30 to 40 million people in any way. Well, the truth of the matter is we do it through, that factor. We do it through the uncompensated care pool of money, which is in the tens of billions of dollars annually. And it's how people are reimbursed for the coverage they're providing and not getting paid for. So we're paying for that today. And in order to make the math work, in order for this arithmetic to work, there's value in numbers. As you have more people, for instance, we establish a pooled activity. We have an exchange that is established, not yet, but it's coming into the near future with, in 2014, with the Health Care Act that was done. It will enable small business that may have 3, 5, 10, 15 employees to all lump their actuarial outcomes into one pool, which then enables people to have more affordable coverage. Our small business community is professed to be the backbone to our economy, the springboard to our economic recovery. If we truly believe that, if we profess that, then we need to act accordingly. And today, small business pays 18% more than industry does as an employer to cover their employees with health care coverage. That's unacceptable because we want to empower our small business community. And earlier we had talked with a fellow student of yours about the need for government to be involved in programs. Well, if we can cut that 18% discriminatory factor on small business, then we'll achieve something for small business in that attempt.
What is the biggest gain based on your prior opinion?
Biggest gain will probably be the efforts to cover those who are now getting a haphazard bit of health care where they may enter into an emergency room and visit with a team of doctors or an individual doctor. That won't be anything near the team they'll see the next time they're there. And there's not a continuum of care. There's not the coordination and the collaboration that's essential. And the lack of affordability in that regard also, where we're paying for this far from efficient care, much more costly to us, the taxpayer, to us, the ratepayer, and inhumane to the person who's uninsured or underinsured. So I think that's the hugest benefit, the humane concept and the economic concept that come into one similar common argument, and that is covering the 30 to 40 million that have been denied that coverage, sometimes by the sheer desire and whim of the insurance company, because they can use pre-existing conditions as a rationale to not provide coverage. And those excuses can range from stroke, cancer recovery, remission, and diabetes, to some of the most unbelievable concepts: domestic violence, acne, toddler obesity, the number of pregnancies a woman may have had. So that discrimination no longer will be tolerated.
Being involved on the national level, how do you think the healthcare bill affects your hometown of Amsterdam?
Well, I think it addresses it favorably because, for instance, one of the factors is to cut the copayments and deductibles for our nation's seniors, to encourage them, to enable them to better afford the ongoing efforts for prevention and annual checkups and screenings. This is a huge benefit to a county like Montgomery, where there is an inordinate size population of senior citizens, many of whom are not on a goal, sitting on a golden nest egg of retirement. So I think there's a lot of benefit there, and enabling, again, our hospital systems to be relieved of that misuse, inappropriate or inefficient use of their resources in a way that is now going to be turned around.
Concerning the new health care bill, how will it affect taxes and revenue on a state and national level?
Well, I think once you address health care, you address Medicaid, Medicare, any of the programs that are currently charged us as ratepayers or taxpayers. As ratepayers, we'll see a decrease in that hidden assessment that comes for the uninsured. That's about $1,000 per premium. So I think that helps us. In terms of taxpayers, if you have unusually large populations of Medicaid eligible, you'll see relief in that regard, because this program will affect any healthcare delivery system to the good. So I see it, again, as a favorable outcome.
And lastly, where would you like to see healthcare in the future years to come?
I think that will involve more and more technology, more and more advanced data keeping, and probably improvements through investments in R&D and research that will allow for much less invasive situations where patients will win and dollars will be reduced.
Interesting position.